Welcome back to our second class for DBT. All right, so let's continue with where we stopped. Okay, so today we'll be doing the benefits of DBT therapy. All right, so I hope you can see the screen now. So, according to DBT or according to the benefits of DBT, it includes the emotional regulation. Okay, so emotional regulations and the skills to manage the overwhelming feelings the person has been feeling for a very long time. The distress tolerance techniques to handle the crisis, then without resorting to harmful behaviors, mindfulness practices to stay grounded and present, and interpersonal effectiveness skills to improve the communication and build meaningful connections. Okay. So by fostering self-awareness, resilience, and healthier coping strategies, DBT only helps clients. One DBT only helps clients reduce emotional suffering, but also enhances their overall well-being, quality of life, and all of that. Okay, so quality of life, overall well-being, and in addition, the DBT emphasizes on acceptance, change, helping individuals accept themselves as they are, while working towards something which is meaningful to change. Okay, so in DBT, do they emphasize specifically on acceptance and change? Okay, so a person to grow. Okay, so you need the very two things, which is first you have to accept yourself, and then you have to accept that change is a constant thing, and helping individuals accept themselves as they are while working towards something which is meaningful in life. Okay, so if you are changing for your job or for your life partner, so that is something which is really meaningful, right? So yes, themselves as they are meaningful for life. So radical acceptance encourages embracing reality. Okay, so, for example, if you're a person who's on a healthier side, and because of that, you've been facing a lot of mental health problems because you've been facing a lot of body image issues. So, that will help the person to accept, okay, and encourages them to embrace the reality, like however you are, and that will help you to accept yourself and then move forward and work towards yourself also. Okay, so that your confidence and self-esteem is something um which is not being deteriorated in any way. So even if when it gets difficult, fostering peace of mind is also something that DBT helps with. So benefits of DBT, if we see, then validation is another core element that we work on. Okay, which includes acknowledgement and empathizing with the person, okay, with the person's emotions and their experiences, helping them feel heard and understood. Okay, so through behavioral analysis, DBT also helps clients identify these kind of patterns. Okay, so validation, okay, empathizing and acknowledging their emotions and experiences, helping them feel heard and understood. These are the top three things. Then we have through behavioral analysis, DBT also helps clients make healthier decisions, okay, identify patterns that contribute to their distress, allowing them to be more intentional and have more healthier decision making by fostering self awareness and resilience. Okay. Healthier coping strategies. DBT not only helps clients reduce the emotional suffering, but also enhances the overall well being of the person, also, right? So, अगर हम अपने आप को accept करेंगे, अपनी चीजों को हम और अच्छे से, if you are aware of ourselves, then, right? So, इससे क्या होता है कि we not only cope with the problems in a better way, but also it enhances our overall well-being, okay, and quality of life. So the therapeutic approach integrates both the individual therapy and the group skills, training to provide a comprehensive support system for the clients, ठीक है? So इसमें ग्रुप थेरेपी भी होती है. You also have individual therapy that involves a lot of emotional catharsis that has happened with the client also, and it helps a comprehensive support system for the clients. Benefits of DBT. Okay, so it reduces self-harm, helps clients in a better way to face their own challenges in life, improves any kind of relationships if you have, and this is with any kind of therapy. Okay, so it improves any interpersonal relationships that you have. Decreases substance abuses, reduces symptoms of depression, increases the coping skills and improves quality of life. All right. Now, considerations. Okay. Although many we have seen like encouraging results in DBT, it's vital to recognize that not everybody will benefit from DBT, of course. So the different results can result from different results can result from variety of factors, okay? So including individual vi variability, treatment adherence, and intricacy of certain mental health issues. Okay? Furthermore, DBT demands a substantial time and energy commitment. Okay? And some people may find it difficult to participate completely or apply the skills they acquire in therapy to their everyday life. For individuals who might not react well to DBT, it is essential to think about individualized treatment programs and investigate therapy modalities. Okay? All right. So now let's do DBT versus CBT. Okay? So what is the difference between dialectical behavioral therapy, CBT, acceptance and commitment therapy, uh, mindfulness based cognitive therapy, and schema therapy, but differs in its approach and focuses and techniques. Okay, so there are like a lot of different kinds of therapies that DBT में difference हम वो करेंगे, बताएंगे. So first is DBT versus CBT. Okay, so DBT is rooted in CBT, emphasizes balancing acceptance and change. ठीक है? While CBT focuses on identifying and correcting the negative thought pattern, the DBT combines this with the mindfulness, okay, and emotional regulation. तो वहां पे CBT में हम thought patterns को change कर रहे हैं, लेकिन DBT में हम mindfulness and emotional regulation skills को कर रहे हैं. ठीक है? So DBT is more structured. बहुत ही structured form में है, includes skills और training in areas like distress tolerance. ठीक है? Which is particularly useful for individuals with emotional dysregulation. So unlike CBT, which focuses mainly on cognitive restructuring, ठीक है? So basically इसमें difference उन्होंने जो बताया है is that the CBT focuses more on the cognitive restructuring, whereas DBT focuses more on the emotional regulation and जिसका डिसरेगुलेशन है उसको ठीक करना, उसको रिस्ट्रक्चर करने के लिए. सो यहाँ पे मोर इमोशनल है, वहां पे मोर कॉग्निटिव बेस्ड है. Then we have DBT versus ACT. ACT is acceptance and commitment therapy. ACT helps individuals accept their emotions and commit to actions aligned with their values. ठीक है? So promoting psychological flexibility. So while DBT also emphasizes acceptance and it is more structured with specific skills in mindfulness, emotional regulation, and interpersonal effectiveness, right? But DBT focuses on managing the emotional crisis. मतलब यहाँ पे हम कैसे हम सिर्फ एक्सेप्ट एंड कमिट कर रहे हैं, राइट? यहाँ पे साइकोलॉजिकल फ्लेक्सिबिलिटी भी होती है, बट डीपीटी ऑल्सो एम्फसाइजेस ऑन एक्सेप्टिंग. इट इज मोर ऑफ अ स्ट्रक्चर्ड विद स्पेसिफिक स्किल्स, मतलब कि विद माइंडफुलनेस, इमोशनल रेगुलेशन, इंटरपर्सनल इफेक्टिवनेस. ठीक है? So DBT focuses more on managing the emotional crisis and behaviors, whereas ACT centers for living in accordance with your personal values. ठीक है, एंड डिस्पाइट डिफिकल्ट इमोशंस. तो यहाँ पे हम अपने पर्सनल वैल्यूज को भी लाते हैं, whereas DBT में हम सिर्फ इमोशनल क्राइसिस एंड रेगुलेशन की ही बातें करते हैं. ठीक है, ओके. Now DBT versus MBCT. MBCT मतलब it combines the mindfulness with CBT, okay, to prevent the depression relapse. As we said, the MBCT is mindfulness based cognitive therapy. ठीक है, so it uses mindfulness techniques to help individuals detach from negative thoughts. DBT also focuses on mindfulness, but uska pura target is not only on mindfulness. It's a part of DBT, but goes further by targeting behaviors, emotions, interpersonal skills, and all of that. Okay, so DBT focus is broader rather than MBCT बहुत ही specific हो जाता है. Then we have psychodynamic therapy. Okay, so psychodynamic therapy में हम unconscious mind and past experiences, whereas DBT is more focused on the present experience. ठीक है, यहाँ की present emotional regulation के बारे में बात करते हैं, behavioral changes के बारे में बात करते हैं, whereas DBT is structured and action oriented. Offering concrete skills for managing emotions and crisis, unlike the psychodynamic therapy, which tends to delve into the past conflicts also. Okay. And last is DBT versus schema therapy. ठीक है, so schema therapy जो होती है वो focus होता है more on identifying changes in a deeper seated maladaptive schemas. Schemas मतलब जो deeper rooted problems होती है उसको हम schemas कहते हैं. ठीक है, developed from unmet emotional needs. While DBT also addresses the emotional regulation and relationships, but it's more structured. जैसे हमने ACT के बारे में किया था कि ये ज्यादा structured है, आज specific skills के बारे में हम बात करते हैं. ठीक है, it's more of a structure with specific skills, managing crisis, emotional survival, making it more practical in real time. Okay, so yes. So role of DBT in psychotherapy, in group therapies. ठीक है, so DBT again, as we said, structured specific skills psychotherapy developed to help individuals managing intense emotions. Okay, intense emotions improve interpersonal relationships. In group therapy settings, DBT offers a support environment where participants can learn and practice the essential skills that are more needed. ठीक है. So इसमें क्या क्या स्ट्रक्चर होता है? फर्स्ट वी गो थ्रू द माइंडफुलनेस, देन वी गो टू डिस्ट्रेस टॉलरेंस, मतलब कि डेवलपिंग the strategies to cope with the crisis without resorting to the maladaptive behavior. ठीक है, जहाँ पे हम strategies को करते हैं in distress tolerance कि हमें distress अगर हो रहा है तो क्यों हो रहा है और उसको हम सुधारने के लिए क्या क्या टेक्निक्स को हम इस्तेमाल कर सकते हैं. ठीक है, इमोशनल रेगुलेशन, लर्निंग टू आइडेंटिफाई एंड मैनेज द इंटेंस इमोशंस जो भी होते हैं. ठीक है, एंड इंटरपर्सनल इफेक्टिवनेस, इम्प्रूविंग द कम्युनिकेशन, जिसकी वजह से हमारे रिलेशनशिप्स भी इम्प्रूव हो जाते हैं. ठीक है, सो माइंडफुलनेस, distress tolerance, emotion regulation and interpersonal skills, effectiveness. ठीक है, सो ये हमारे यूजुअली ग्रुप एक्सरसाइजेस में होते हैं, रोल प्लेइंग में, होमवर्क असाइनमेंट्स में, ताकि वो रीइंफोर्स करते हैं लॉट ऑफ लर्निंग एंड अ लॉट ऑफ रियल लाइफ applications as well. बेनिफिट्स ऑफ डीबीटी में क्या आते हैं जब वो ग्रुप थेरेपी का पार्ट बनते हैं? फर्स्ट इज ऑफ कोर्स द पीयर सपोर्ट, राइट? यू नीड पीपल जो आपको लगे कि वी आर नॉट लोन एंड दे आर ऑल्सो देयर विद अस, दे आर ऑल्सो सफरिंग समथिंग लाइक वी आर, यू नॉट आइसोलेटेड इन इट. स्किल रीइंफोर्समेंट, तो जितना प्रैक्टिकल स्किल्स इन अ ग्रुप करते हो, सेटिंग अलाउज फॉर इमीडिएट फीडबैक. ओके, an opportunity to observe others and learn from them also. Then आता है cost effectiveness. Okay, so group therapy provides more affordable treatment option compared to individual therapy sessions. ठीक है? All right. Okay, so DBT and addiction management we will do in the next class. Until then, thank you so much for watching, and I'll see you in the next class. Bye.